1 in 3 seniors above the age of 65 would have experienced a fall or would experience a fall. That's startling. What are the biomechanical or the physiological reasons for this? I mean, why does this happen so much?
So falls is multi-sectoral, multi-dimensional, so it's not always one thing that causes. But there's been tons of research to understand what are some of the risk factors that predispose somebody to fall. And when they've looked at some of the predisposing factor, number one is your functional capacity. So do you have sufficient balance? Are you're strong in terms of your muscle strength? Those are one arc. Environment has been known to be a risk factor. Is the lighting in your house sufficient to be able to see clearly where you're taking your foot? Or is there a loose rug on the floor that's going to trip off your feet? And so again, looking at those kinds of dimension is important. Vision, right? Some people don't get their eyes checked, and that's incredibly important. So if you're not having a appropriate level of vision with your glasses, those are easier things to do. So in my own research program, I have two arcs. One is epidemiology of falls. That's a big word to say. I study the trends and patterns of what causes a fall. And then the second is when I understand and know what causes a fall, I intervene and I provide intervention research. Then that reduces the incidence of falls. And I work with the system, so in long-term care setting or home care, where services that are delivered to the seniors' home in Canada. So I use system-integrated, policy-relevant research in this area.
And we come back to functional capacity again in trying to understand falls. So functional capacity, as you said, can be enhanced even while you're quite advanced in your age. But what I'm picking up is it is best to start young. Keep your functional capacity intact and be agile. What is a good way to test whether I am, doing a good job at it? I'm 53. How do I know whether I'm okay for an older Mahesh?
Mm-hmm. So there's a number of ways. There's fitness assessment that is done, very much like we would do nutrition assessment or assessing the functionality of an equipment, for example. So there's a battery of tests your personal trainer can assist you with and give you scores that then give you what is your functional capacity. But sometimes in my research, I can't bring seniors to a gym. So I do very simple tests in the people's home. For example, one test I really like is called functional fitness test or functional mobility. It's a 3-minute walk test, 3 meter. So people get up from the chair, walk 3 meters, come back and sit down. The amount of time that's taken is calculated. So we do the assessment pre and post intervention to see if we have made a difference in terms of their functional capacity.